Assalamu alaikum wa rahmatullahi wa barakatuhu. I, Dr. Mohammad Akram, Department of Eastern Medicine, Government College, University, फैसलाबाद. आज मैं डिस्कस करूँगा randomized clinical trials study designs and its types. Presentation outlines. Why do randomized control trials? Randomization, why and how it is done. RCT classifications, studies designs and steps of RCT, minimizing bias in intervention studies, allocation, concealment and blinding, human experiments, can you identify? In 1947, Lind tested the effect of lime juice on the occurrence of scurvy on Royal Navy ships, a major health problem on long voyages. Crucially, Lind randomized which of his patients received the treatment lime juice plus several other liquid tested. In 1946, Sir Austin Bradford Hill streptomycin for TB, the first published RCT in medicine, appeared in the 1948 paper entitled Streptomycin's Treatment of Pulmonary Tuberculosis, which described medical research council investigations. One of the authors of that paper was Austin Bradford Hill, who is credited as having conceived the modern RCT. Definition of RCT: an epidemiological experiment in which subjects in a population are randomly allocated into groups, usually called study and control groups, to receive and not receive an experimental preventive or therapeutic procedures, maneuver or interventions. RCT can be used to evaluate the safety of a new drug in healthy human volunteers, assess treatment benefits in patients with specific disease, compare a new drug against existing drugs or against dummy medications or placebo. Randomized clinical trials: patients, random assignment, treatment group, control group, follow up and compare results. Randomized: estimate bias in selection or allocations, biases or confounders, known or unknown. Controlled: interventions compared to a group. Control, active or placebo, both groups identical except for intervention or exposure. Investigator has control over the process. Trial: experimental interventions, effects unknown to investigator. Ethics in RCT: although the principle of clinical equipoise, genuine uncertainty within the expert medical community about the preferred treatment common to clinical trials has been applied to RCT. The ethics of RCT have special considerations, almost always provide informed consent for their participation in an RCT. Trial registrations: in 2004, the International Committee of Medical Journal Editors announced that all trials starting enrollment after July 1, 2005 must be registered. Clinical Trial Registry of India, hosted at the ICMR, National Institute of Medical Statistics, is a free and online public record system for registration of clinical trials being conducted in India. Thank you very much.